Steve Moran here with Senior Living Foresight, and I'm really excited. I've been looking forward to doing this story. Actually, I've been looking forward to doing this story for months. I didn't even know who I was going to do it with. So I have with me here Sarah McVey, who is the CEO of Sequoia Living, based out of the Bay Area. What town are you in?
Our corporate offices are in San Francisco.
Okay, and you have 5 communities in the Bay Area, is that correct?
We have 4 communities, life plan communities, one that just opened in Walnut Creek 2 weeks ago. And then we have 3 affordable communities in the Bay Area and a 4th community up in Mendocino County. And then we have 2 senior centers in San Francisco.
Okay, terrific. And I am also talking to Wes Baird, is that right? And
Wes
Baird, give me your last name.
Okay, it's Wes Bard.
Bard. What a great name. And Corinne?
Sartorio.
Sartorio, great. Okay. So the reason, so you guys were on practically the first day to get COVID infection, vaccines, not infections, vaccines, right? And let's actually, the first question I have is, do you have any idea why you were picked to be so early?
We do. Wes, would you like to share?
Well, since the beginning of COVID-19 and putting into shelter in place throughout the state and in the county, we were somewhat proactive. We started a couple weeks before, and because we really thought there was an issue that was going to happen. And we have worked really closely with the county, and upon us, anytime we had an infection of staff, and we talked to the county, we responded immediately with all the protocols that were requested of us, with response testing. We were the first facility to initiate testing of all staff and testing of all our residents within a 2-week period. And that's been several months. And it's just been a great relationship. The county at times has asked us to review documents before they put it out. We developed a very strong relationship. Also, prior to this, the county runs an emergency operation plan. They call it Mohawk. With that, we are the strongest healthcare facility in Marin to work with them. We are on every single session call that they have. Every time there's an earthquake drill or any drill, we are the only facility that is there 100% of the time.
Great. Let me actually back up for a second. Tell me what levels of care you provide there.
We provide independent living. We provide nursing care and assisted living.
Perfect. And how many residents?
In total, about 283.
Perfect. Perfect. So when you got that call or email or however they communicated with you that you were first on the list, how did you feel about that? Were you excited, scared, nervous? And I'd love to hear just your kind of how you reacted emotionally to that.
With my reaction, I almost cried of the relief. And then I immediately sent the email to Corinne and her team. She leads the clinical team, and their relief, she can explain.
Excited and happy and couldn't wait for it to happen. We were disappointed when we got delayed by a day. We were ready to go on Wednesday and it got delayed, but it was like, that's okay. We have hope now. We can see the end of this horrible pandemic that we've all been facing for several months, and relief and joy.
Corinne, tell Steve how long you've been a nurse.
48 years.
Wow, that's
48 years.
Yeah.
She's seen it all.
48 years.
Any fear?
I don't look that old, right?
I thought you were 29. I thought you were 29.
My staff said that too.
Have you had any resistance at all on the part of staff and or residents? And so you've done staff but not residents so far, correct?
Correct.
And
correct, but we got case for most of our residents, they're ready. We do have resistance from some of our staff. Some of them we've all already been able to change with some one-on-one education, with some group education in small groups. And so we're going to continue to work on doing that. And they're seeing, excuse me, Wes, they're seeing that we took the vaccine yesterday and we're here today. Our arms are a little sore, but we're okay.
That was my next question, right? So, how many staff members how many people were inoculated?
We're trying to get the clear numbers. We know it's over 100. We're waiting for county to respond to that. And of that 100, I think we had 3 that had some discomfort right away, but they were still able to work their shift. And I think, like Chris said, there's a lot of people, they wait and see, they read all the stuff in the newspapers and Facebook and those type of things. But I think reality is definitely will help when they can see, hey, the rest of us, my arm didn't fall off, and we're all okay. There's no issues.
We didn't have anybody with anaphylaxis.
Right.
There was a couple people in Britain that did, so they figured that was going to happen to everybody. We also had a number of people that were registered for the afternoon that would have gotten it yesterday, but the county had to change their plans. So we're hoping to get them in our second meeting time here over the weekend.
And our second meeting time has been announced to us as Sunday at 2:00. So if you want to make yourself available,
Yeah.
Man, I got to tell you, I'm pretty tempted to do that. I just think that so it's funny. I've been thinking somebody put out, I forget who it is, LA Times or somebody had a calculator that you could use to figure sort of based on your age and factors. And so I actually ran myself through it. And primarily because of my age, I'm 65. I think I'm like at the 14% level. So there are 14% people above me who are going to get it before I do. So that's pretty close. And there's a little bit of me that sort of goes, and I guess because I read this news too, right? There's a part of me that says, well, I'm not that brokenhearted that I'm not the first person to get it. But that being said, if somebody came to me and said, if you want it now, here it is, I would be there. 100%. So, and frankly, I think most people, once we see that your arm doesn't fall off, Wes, as you say, it'll be fine. So,
I hope so.
So once you get your staff inoculated, will you be able to get rid of, what's the health department telling you? Get rid of masks and your PPE, or what's going to happen with that?
No, they anticipate that we're going to be wearing masks for quite some time to come. They don't know. We'll be having a second vaccination in 21 days. And everybody's going to have to be vaccinated, not just the healthcare workers. So that means our resident, and then when we have our community coming in, our visitations and things like that. So I imagine we're going to be using our protocols for a long time to come. There's even some talk about, they don't know the effects of protection. If we get to 70% or above, we'll be doing great. But they're talking, at least Dr. Willis yesterday out there was talking about maybe another booster vaccine at some point. They have to see how we all react to this.
Gotcha.
And how we build our immunity.
For your listeners, I highly recommend that you kind of really emphasize this as a community. When you have the chance to get vaccinated, get vaccinated. The more we get vaccinated as a community, as a state, as a country, the better we will be, and the shorter it will be to the end.
Yeah. So that's really cool. I'm so, when you were telling me the story about, I got the sort of almost tears in my eyes, because it's about saving lives, and that is so powerful. And I just, when I see people saying, I won't take it, frankly, it just hurts my heart, because it's about those people's lives, but it's also about other people's lives. And
Exactly.
And I think staff at the TAM really got that. As they were standing in line, I videoed videotaped what I said, how are you feeling today? And majority of them were like, I'm making history. I'm saving my family. I'm saving my friends. I'm saving my coworkers. I mean, this is like man on the moon stuff, and the staff get it. And I would say there's far more that are honored to be vaccinated than the ones that are concerned about it.
Perfect. Thank you
Steve,
so much.
hey, Steve,
Yes.
for us though, I've been taking care of the elder citizens in around the country for almost 37 years. And Corinne, in her healthcare year of 48 years, she's been at the TAM 20. We've lived our lives taking care of people, and this has been such a monster for us to deal with and we've made a serious commitment to take care of people. And that's why we really want to emphasize for people to get the vaccine and be part of the success of everything.
Yeah.
So one of the questions I should have asked earlier, but want to still get in. So how many have you've had cases in your building?
Yes, we've had 2 residents since June 4th, and we're up to 23 staff, I believe, at the current time.
Yeah, the staff is so much more difficult because they're more mobile and so many, particularly in a place like the Bay Area,
Right.
the cost of living is so high. People got to work multiple buildings, and so
Yeah.
And you have multiple staff that live with multiple staff.
Multiple staff,
Yeah,
multiple family households.
yeah. So, but 2 is actually really, I've talked to so many people who've had so much worse than that. That's really, really, really remarkable. So anyway, thank you very much. What a hopeful story to finish my Friday on. I can't tell you, how lucky you are. And wait a minute, that's not fair, because truthfully, you've done a bunch of really cool stuff to make the world a better place in your community. And so you've gotten this little reward for that, and that's terrific. So
Our reward is taking care of the people that we care for and each other. And
cool,
when that happens, that's a reward.
cool.
Yeah. Sequoia strong. Yep.
Yeah.
Quite strong.
Maybe, you know what? Merry Christmas. What a Christmas present, right? What a Christmas.
Yeah.
Thank you.
So,
All right. Thanks,
amazing
Steve.
thing. So,
Thank
thank you
Steve.
very
Merry
much.
Christmas.
Yeah. Good seeing you.
Good to see you. Bye-bye.
Bye.
Bye, Mary.
Bye.